My name is Dr Bob Ryder from Birmingham in the United Kingdom, and I'm presenting here the 2-year outcomes from the United Kingdom's first National Health Service to use EndoBarrier. These are my disclosures, and this is a picture of an EndoBarrier, a 60-centimetre impermeable sleeve that's implanted during a simple endoscopy procedure into the first part of the small intestine, such that the food passes through it rather than the small intestine, and it mimics the bypass bit of the Roux-en-Y bariatric procedure. Our experience of EndoBarrier in Birmingham is based on 2 research studies sponsored by the Association of British Clinical Diabetologists, and one of these is presented in e-poster 2015P. In the wake of that, we established an NHS service in 2014 and implanted 62 EndoBarriers, the last one of which was removed in November 2018. And by November 2019, all 62 patients had reached 1 year after EndoBarrier removal. And of these, 46, i.e. 72%, attended for review a year after removal. The criteria for receiving EndoBarrier treatment in Birmingham was type 2 diabetes, a BMI greater than 30. The patients must have already tried everything else, diet, lifestyle, other medications, including GLP-1 receptor agonists and SGLT2 inhibitors, such that the only options left were either to start insulin or, if on insulin, to increase the dose further. And of course, the thing about that is, as we all know, giving insulin to drive down hemoglobin A1C in obese people just increases the obesity further, which is always, I feel, counterintuitive in people who are already obese. This is the group of people we treated, a BMI of 41.6, hemoglobin A1C 9.2%. They'd had diabetes for 14.5 years. They pretty much tried everything, and nearly 70% were on insulin. And this is what happens during the year of EndoBarrier. They lost 17.2 kilograms. The hemoglobin A1C dropped from 9.2 to 7.3. And of course, the question we're addressing here, and the one you're interested in, is what happened after we removed the EndoBarrier. Well, the bottom line is that 39% of them managed to sustain the improvements over the year after EndoBarrier. 39% managed a partial sustainment of improvement, and 22% deteriorated back to baseline. And this shows the data on these groups of patients. You can see here the weight and hemoglobin A1C being maintained in the 39% who sustained improvement. This group here, they significantly deteriorated in weight and hemoglobin A1C during the year, but they remained significantly improved compared to baseline. And in this group here, there was deterioration all the way back to where they'd started. I have to say that we found in clinical practice that those who deteriorated reported to us many problems in their lives, and 90% were experiencing depression and or bereavement. But that wasn't the whole story, because when we looked at this group of patients who deteriorated back to baseline, they'd experienced less weight loss and less improvements in hemoglobin A1C during the year they had the EndoBarrier treatment. 10 of the patients required early removal of the EndoBarrier, 4 of them for gastrointestinal hemorrhage, 2 for liver abscess, 1 for another abscess, and 3 for gastrointestinal symptoms. And it's worth pointing out that all made a full recovery, and most derived considerable benefit despite the early removal. And in some patients, it was clear that the problems were related to non-compliance with advice given. So for instance, this first gentleman here, during the 2nd week after the EndoBarrier was placed, he reverted to normal food instead of taking the recommended puree diet, and that disturbed the EndoBarrier and caused a GI bleed. So he only got about 2 weeks of treatment. This gentleman here, after 10 weeks, stopped taking the recommended proton pump inhibitor, and he had a GI bleed, require removal, but nevertheless, during those just 10 weeks, he lost 9.6 kilogram with a dramatic improvement in hemoglobin A1C and requirement for insulin. This lady here at 10 months went out for her wedding anniversary meal and had a steak and swallowed a piece of it and blocked the endobarrier such that it had to be removed. She had been told that it's important to chew your food, and in fact, steak was actually pointed out as something to make sure you chew, and she accepted full responsibility. But even in her case, she lost 23.6 kilograms during the 10 months with EndoBarrier, and she's a great fan of the EndoBarrier treatment. This gentleman here was on our intensive care unit in the hospital with a liver abscess, which wasn't recognized, and he was in fact being treated with pneumonia. And I think that would never happen now, because at the time this happened, we weren't aware of the liver abscess problem in association with EndoBarrier, which is now well known. So I don't think in the future anybody would not know. It will be the first thing to be thought of in any patient who develops pyrexia. But he lost 18.4 kilograms during his 7 months with EndoBarrier. The hallmark of type 2 diabetes and obesity is hepatic insulin resistance and beta cell failure. And I draw your attention to the dramatic improvements in ALT as a marker of liver fat that occurred in our patients. And we know this from a study we did with MRI measurement of fat in the liver and pancreas, showing a dramatic improvement in the liver fat in association with the ALT marker, as shown here. And it's known from the work of Roy Taylor that reduction in hepatic fat is associated with improvements in hepatic insulin sensitivity, and reduction in pancreatic fat is associated with improvements in insulin secretion. So we think this probably plays a big part in how the hemoglobin A1C improves so much with this treatment. These are some examples of our patients. This lady was our first to go from obese BMI to normal BMI, and you can see the marker of liver fat greatly improved alongside a hemoglobin A1C, and a year later she has sustained the full improvement. This lady here had obstructive sleep apnea as well as diabetes requiring CPAP, and after losing over 46 pounds, she no longer required CPAP. And again, she has maintained the improvement a year later and still doesn't require CPAP. And I draw your attention to e-poster 2015P, which is the final results of our EndoBarrier in obstructive sleep apnea study. This lady losing 43 pounds with EndoBarrier, her insulin requirement dropped from 147 units to none. And alongside this, there was a big improvement in renal function. And a year later, the improvement in renal function is sustained and she remains off insulin. And I draw your attention to e-poster 2009P, which is all about the renal function data from our EndoBarrier treated patients in Birmingham. A third of our patients who are on insulin were able to discontinue insulin, and this is one such. A dramatic improvement in hemoglobin A1C. Prior to EndoBarrier, her insulin requirement was 260 units, and when she went from a BMI of 39.3 to a normal BMI, she no longer required insulin. And this is a slide showing all the insulin pens that she used to consume before the EndoBarrier induced weight loss, which are no longer required. And this is all the other paraphernalia that's no longer required: the glucose testing strips, the pen needles, the lancing devices, the sharp spins, all a great deal of money, of course. And a year and a half after removal of EndoBarrier, her improvement is sustained, and we worked out that she saved 474 insulin pens. So in conclusion, we found EndoBarrier to be highly effective in patients with refractory diabetes, with maintenance of significant improvement a year after EndoBarrier removal in 78%. 32% of the patients deteriorated back to baseline. Sorry, 32% of the patients were able to discontinue insulin, the insulin-treated patients. 22% deteriorated back to baseline, and of those, 90% had depression and or bereavement. There were very high patient satisfaction levels, and in our opinion, the risk-benefit ratio with regard to EndoBarrier treatment is strongly towards benefit. And as endoscopy units are ubiquitous in health services and could easily deliver this day case procedure, our service could be readily disseminated widely.